think you should be able to come back to it if once he gets
Okay.
here.
Okay, so we'll hold off on it, item 3, and, that means, Jay, that means you're up for a RAM clinic update. You can't possibly have any news.
No news, just a couple of things really for you folks, in terms of signing up as volunteers. But first, just we had our first community host group meeting on, so that's just like the chairs of each of the activities. We had that on the 9th, and we scheduled a cadence and a date to meet with RAM. So you could have to do that every month up until the time of the clinic. So we'll do that. We're going to do that in the second week of every month until August. So just got that news today. But what I wanted to mention, and this is the last thing. So Laura, I just sent you, in response to this meeting invite for this Board of Health meeting, the link to the RAM volunteer website. And so for Ed Berman and Dave, they would go on and register as community host group members. If you haven't already done that, I don't know if you guys have. But if you haven't, Laura will send out the link. And then for other folks like Raj, Laura, if you're going to be involved, I know Raj, you definitely will. Laura, if you're going to be around and want to be involved,
Sure.
you'd be general volunteers. And we're just trying to get a head count. That's kind of why I'm pushing it now. And of course, if anything comes up, you can cancel. And then Ron, you would sign up as a physician, just like you did before. And Barbara would sign up as a nurse if she wants to do it again too. So, so now's the time to do it. And yeah, Laura, if you could send that out, I'd really appreciate it. That would be great.
Sure. Do you want it on the website as well? Can we put it on the
Yeah,
website?
yeah, definitely. Did we do that? I think we did that last year.
Yeah, we did.
Okay. Yeah, perfect. Yeah. The sign up thing's a little kind of funky. You got to go in first, find the Framingham Clinic, and then kind of choose the days that you want to volunteer for, things like that. You can walk your way through it, but if you don't get an email back, then you didn't get registered. So just remember that if you don't get an email back, first check your junk mail or your spam folder, and if you didn't, then something went wrong, and you can let me know. I mean, it's not rocket science, but it can be a little confusing. So, but that's all I had, unless there are questions.
Okay.
Yep.
So, do you have any more heavy lifting to do? Or
No.
is it pretty smooth?
It's pretty smooth. I mean, we have a plan for fundraising, and my wife Liz is taking care of that. I think I've got the things last year that I required a lot of effort just on my part was like the parking lot, figuring out who's going to be in the parking lot at night and during the day. I think I've got that covered, which is good. And so then it's just kind of recruitment. And what I'm trying to do is connect Ed Berman here and Dave, who are our recruitment guys, with the volunteer coordinator over at RAM. And once they make a connection, and by the way, you guys, that might take a little while. I think I mentioned that they had the Knoxville clinic, but she knows that you want to connect. But once I connect them, they'll have a better idea of what needs to be done for recruiting people like you, Ron. So just the professionals. And then that should be it. I mean, all the other stuff, everybody kind of knows what they're doing. Steve Mitchell with hospitality and Ed Hart with promotions. We're in good shape.
That's great.
Yeah.
Right. Well, thank you and Raj and Ed for undertaking this again. It's still an unbelievable task. So
Yep.
That's great. Dave, anything?
And I will definitely get in touch with you, Raj, within the next, I would say, maybe not the next 2 months, but as we get into the spring about the food permit and all of that.
Absolutely. So I'll take care of that, so
Okay.
should not be a problem.
Okay, thanks.
Dave, Ed, anything? No? Okay. All right. Jay, thanks as usual. All right.
All
moving
right.
on.
Thanks, you guys. Thanks, Ed and Dave.
Yeah. Moving on to item 5, Health Director's agenda. You're up, Raj.
Thank you, sir. So lot of housing stuff going on, in the community. Chestnut Place Apartments, as from before, we have couple of open cases. They're definitely better with the dumpster, and the trash. There is one pending case, that I reached out to the manager a couple of weeks back. I have not heard, so couple of pending cases still there. Uh, we have picked up a couple of cases at Serious Apartments. One was last week. One was actually this morning. It was a trash complaint, ongoing trash issue at the compactor area. So I've sent them a order to correct letter today. Did get a reply from the manager, a few hours back that that's been taken care. There might be another hoarding case that might be at the Serious Apartment that we are looking into. 137 Pond Street, I have sent the board an email from AG's office. They have finally sent a demand letter to the occupants, owners of the building. I guess they're giving them 7 days to respond, or else they're going to move forward with filing this in court.
Can I ask
Another
a
update,
question? Can I ask a question on that real quick?
yes, sir. Yes,
So
please.
I noticed the letters were sent to a motel. Are we sure that they're even still there?
That is correct, sir. So I checked right the day, on that day the letters was posted by them that one brother, right, is still in that room. That we have
Okay.
verified just before sending the letters out. I have coordinated that,
Okay.
and I'm in contact with the Monticello people. So it was updated the same day the letters were sent.
Okay. Thanks,
But
Raj.
thank you, sir. At the same time, this was a couple of weeks back. PD found one of the brothers living in another van, uh, and the building commissioner Doug Scott was out there last week, to post the letters again on both the vehicles that are on property, right? So he found that they have broken into one of the windows to get power to one of those vans. So there was a cord running from the building to the van. Just an update, So the elder brother was actually found living in one of those vans. That's new on the property.
So Raj, the electricity needs to be kept on in the house.
Sir, we have discussed that, with the building commissioner. I don't know if it is our jurisdiction to cut off the electricity. Something that we have addressed this with the AG's office. I don't know if we have the jurisdiction over cutting power to the building. So I will check more on that, but this came up, when he found the cord running right to that camphor. But like I need to check more that if we can even do that.
Mm-hmm.
213 Trailside Way. This is a new housing case we have picked up. So that's on the housing side. With our permitting restaurant updates, Boston Paint Wall, we have not received application from them. It's like a pending thing from last year, right? Like they were selling food without permit, and then we went in. They did file for a permit last year, but there was a pending item before we were gonna grant them the permit. Our inspector Tom Curran is looking into it. Hopefully, we have an update. And then restaurant Hanto, they are missing a CPR certificate, the choke certificate that we required for our permits. And the last one was the Marathon Deli, and I can update the board right here. I have not seen them here today, but they have since submitted a certified food manager certificate. Why we have to bring, or I have to put them in front of the board, because they didn't have a certified person for over 2 months. And when we communicated with them with the application, I find their attitude a little lax towards, getting the certifications for them and their staff. So that's one reason I have put that in front of the board. And I will check with them. It might be a communication thing, but they did submit a certificate to me on Saturday. This past Saturday. and that was the reason why they was in front of the board at the first place. We did had a salmonella case in the community. Um, I I tried calling to the patient or the individual a couple of times. You know, she spoke to me a little bit one time and hang up the phone. Then I was able to talk to the disease investigation team or infectious disease team at MGH and Women and Brigham Hospital. We are not sure about the cause at this point, but it's probably a traveler's case. You know, the individual did travel to Brazil in the fall. So, um, I mean, I'm not able to fully investigate where this case was from, but hopefully, or probably it's a traveling case, that we got. COVID flu clinics, we have picked up another clinic that's on January 23rd, 10 to 12 at the town hall. This again with the Pine Hill Pharmacy. And I do have an update on the Mill Pond Rest Home. So this afternoon, building commissioner asked me that the Mill Pond have scheduled a fire as well as building inspection with them, and if I want to come along. And at that point, I was like, I have no information besides that letter that we got from them, regarding the transfer. Then I made a call to Rita, and I informed her that, hey, there is some pending work at the kitchen, and we have not received any or updated pest control reports for the month of December and Jan. She did send me a pest control report for December, and she informed the owner of the building so that they can communicate with the new owners about, applying the food permit with the health department, as well as doing the necessary renovations or the items, that they need to do before we're gonna grant them the permit. So hopefully we hear from them, but at this point, we don't have any communication with the new owner as far as, the food permit is concerned. I guess that's all I have, and I'm open for any questions now.
Yeah,
Okay.
Raj, with respect to the salmonella case, so when exactly did the person get treated for the salmonella? When was?
I can give you the exact date, sir.
Well, I'm
guess
just wondering if it's possibly attributed to travel in the fall. I was just wondering, like, how close to the travel the disease showed up, and so could there be another source, or is that fairly definitive?
can definitely be other source, sir. Usually, like salmonella, we do see a lot of salmonella with the food, right? And it can be a pet related thing too, like you can easily pick up salmonella from pets, if that way, right? But very limited information, right? Like there was a travel, the most part that we was concerned about, is to spread, right? And what I found out from the infection disease team there, that for the record, the person was not working, so like we are concerned if they're in the food industry or elderly home or something like that, right? That you can easily spread. But I don't have a concrete information, but both things was negative, right? Like that it was a travel thing that happened. That's one thing, and the second thing, the person was not working, as for the doctor's records.
Okay.
And that's the closest we can get, like information wise. I wish I was able to speak to the patient itself, that they can give us the best information, but that was not the case this time.
Okay, great.
Hopefully
Thanks.
I answered your question, but like the fall travel, we was not sure, but it was somewhere in the doctor's notes that, this person had a travel, but when the travel was, I don't know.
Great. Thanks.
Okay. All right. Thanks, Raj, as usual.
Thank you.
And moving on to item 6, the consent agenda. We were all there for the December 19th meeting. Anybody like to make a motion to pass the consent agenda as written?
I'll make the motion to approve the consent agenda as written.
Okay, that's great. Second?
Second.
Second. Jay, thanks very much. Okay, all in favor? Aye.
Aye.
Okay, all right, that passes 4-0. Thank you. And then I knew this would be relatively quick. So just future items, I guess we'll have Jay and Raj. You want to keep Marathon on there, or anything you need to handle with that additionally?
Yes, sir. I mean, if the board want to see them, I'll definitely ask them to come on the next meeting.
Okay. All right.
Thank you.
Well, I think we should, just to make sure they're going to, try to remain compliant and see what they're going to do about only having one person that's certified. So I think we should do that.
That is correct. So that was my concern, right? I did write
Yeah.
to them last week that we recommend to have additional people, certified, and didn't get a response. So I'll touch base with them tomorrow and tell them, the board would like to see them.
And just for my own and well as everybody else's, that is not a local regulation. These are all state regulations, correct?
No,
That a
sir.
board that-
To have, it's a local regulation to have a certified person.
Oh, it's local. Okay.
Yes. But a lot of communities have that, like the food code, it says like, you can have a certified person, but they can train somebody. Like it's not like a all-time requirement, but what we have in local regs is, from the time establishment is open, there need to be one certified person be available all times. So
Okay.
it's a local reg, sir. Yes.
Okay. All right. Okay. All right. That's great. Anybody else have anything they want to add? No? Nothing? All right. Roger, let us know if anything else, is exciting between now and then. Any,
I will, sir.
I think you can talk about any update on High Street, the extension, the High Street thing.
Yes, sir. So as of our communication, right? So this is a couple of weeks back, right? I guess the whole board knows about the situation at 54 High, or should I just brief, right? So
Yeah.
if this is a property on 54 High that I guess this is like 3-4 months now, right? We have approved their plan, but the plan was approved way back, but they started construction and they found a stream on the property, and they had a cease and desist from the Conservation Commission. This was going on. They was trying to find solution. The current owner was trying to sell the lot. There's a lot of stuff going on, So now, again, they wanna get the work going. So what they have asked us, right, to little modified plans. There was like full of variances that are local that they was asking us for a waiver, and because of the hardship, given that we have approved their plan earlier, now, during the construction part, this has come up, we have agreed that we will look at the plans. So this did send us not the plans exactly, a proposal, that to look at it. But before that, I guess it was on the 8th. They went before the Conservation Commission again, and during one of their site visit, it was found that the steam or the current location of the septic is like only 42 feet, from the wetlands, and they need at least minimum of 50 feet. So the Conservation Commission have asked them to move it still, like move both the house as well as the septic system. That's what I came to know from our agent or director of Conservation Commission. Still waiting, if they approve it, and then they'll send us the plans to review.
Okay. All right. Thanks, Raj.
Thank you, Dr. Ron.
Okay. All right. Everybody else good? All right. So we're supposed to meet February 6th and the 20th next month. So I'm sure everybody can make that. If you can't, just let us know. As long as we have 3, we'll be good. And always the most important motion. Anybody want to make that? Go on, I
Yep.
don't have 3 hands to make that
I'll make the
motion.
motion that we adjourn.
All
Second.
right. Thanks, Chief. Seconded already by Jay. I'm sure thirded by Dave. All right, everybody. All in favor? Aye.
Aye.
All right, that passes. All right, Laura, thank you. Raj, all the
Thank
board
you,
members,
sir.
thank you. Mark,
Nice
you
to see
too.
everybody.
Thanks for always being interested and coming. All right. All right, we'll see everybody in February.
All
Thank you,
right.
sir.
Good night.
Good night.
Thank you,
All right.
everybody.
Yeah, good night.
Good
Thank
night.
you.
Thank you.
Bye-bye.